Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Joseph Mele, and we're talking about the top 5 most common plastic surgery procedures in the United States. The suspense is mounting.
Okay.
Number 2, what is the second most popular cosmetic
Number
plastic
2
surgery?
jumped up a couple spots. It's rhinoplasty, or nasal surgery.
Aha.
So
Now nose
reshaping
jobs,
the nose.
wasn't that, let's say back in the 60s or so, wasn't that at the top of the list? This is really before they had perfected other.
They do all move around. And I think the ones we're talking about today are always the ones in the top. But there have been some improvements in the way that we approach rhinoplasty. I think with computer imaging, we're better able to explain what's possible and what's not possible.
Speaking of imaging, let's take a look at someone who's just had it. Now this
Sure.
is very subtle.
So this is an attractive woman, had kind of a bulbous tip, kind of a round tip, a little harder to tell from the side view, but it does tip up a little bit there, and a small bump up on the upper part of her nose. And what we're able to do with the rhinoplasty is reduce that bump, smooth out the tip of her nose, and then if we were looking at a front view, you can see that the tip has been narrowed and brought in.
Now, generally though, when one thinks of rhinoplasty, they think of someone with a very high bridge,
Sure.
whether it's from a break or just, you know, genetic.
Sure.
That shaving or that
And that's kind of the
restructuring
ideal candidate for rhinoplasty, because it's not a subtle change, it's a significant change. It's usually something that bothers people quite a bit. And it's an area that we have good control over.
Any age restrictions for rhinoplasty?
I don't want to do it too young.
When you hear about
if your nose is still growing,
girls is 13, you get one as a birthday gift. No.
yeah, it's probably worth waiting a few more years than that. Though some people at 14, 16, their nose is done growing. And it's sometimes what I'll do is if I see somebody that young, I'll ask them to come back and see what their nose is doing.
Okay,
and make sure that it's stable.
It's my impression, or at least I don't know where I got this information, that the nose and the ears are the only part of the body that does keep growing.
Well, it's interesting, they sort of stop for a while, but as we get older, the skin on the nose tends to thicken, and it tends to droop and drop a little bit, and the ears tend to get a little bit bigger.
So
the cartilage, I think, is what's growing.
Do you have candidates for rhinoplasty at later ages where
Sure.
because of that?
And some people, it's something that's bothered them their whole life, but they finally get up the gumption to learn about it and find out it's not as scary as they thought.
All right, we're going to leave everybody with a cliffhanger of number 1. We need to take a quick break, but for more information about Dr. Mele, you can call him at 925-943-6353 or check him out on the web at drmele.com or on sanfranciscobreast.com. When we come back on Body Beautiful, we're going to find out which procedure is the most popular in the United States, plus your phone calls. Stay with us.